Hi, I'm Dan Resnicek from Pacific Northwest Urology, and today I'm going to be talking about some limitations of the prostatic urethral lift procedure, better known as Urolift. Now, the Urolift procedure, I've talked about this before, is a great procedure that has really revolutionized the treatment of BPH for men. It's far less invasive than some of the other more traditional procedures and has very similar benefits. Urolift is FDA approved for the treatment of BPH or benign prostatic hyperplasia and treats the urinary symptoms from BPH. Although the Urolift is a great procedure, it is certainly not for everybody, and that's what I'm going to talk about more specifically in this video today. So, in order to understand the limitations of the Urolift procedure, it's important to understand the anatomy of the prostate and how the procedure is performed. Now, I've done another video about how the procedure is performed that you can see in more detail, but briefly, a camera is placed inside the urethra. Then, the Urolift device is then fired with a small suture that transverses the prostate, places one clip on the outer capsule of the prostate, and one clip on the inner portion of the prostate. This then tensions, and if one placed on both sides, those capsules pinch open the inner urethral channel, allowing a better flow of urine and men to urinate better following the procedure. If the outer capsular end piece is not placed all the way to the capsule, it simply pulls through the prostate because the capsule is the thick portion that provides tension, and the inner portion of the prostate is spongy, soft tissue, and that's what allows the compression. That's an important consideration when we talk about the next thing, which are what are the limitations of the Urolift, or what men maybe should be thinking of other procedures as an alternative to the Urolift procedure. The first and biggest limitation of the Urolift is the size of the prostate. There's several important considerations to understand for that. The most important consideration for size is the length of the suture that comes out of the Urolift device. The Urolift device needle punctures through the prostate, and that needle is 3.3 centimeters in length. So, men with prostates wider than about 6.5 centimeters in size may have a hard time, the urologist may have a hard time placing that capsular end piece all the way through the capsule of the prostate. Now, prostates are somewhat spongy and soft and may compress somewhat, but that's a significant limitation. So, men with prostates much wider than about 6.5 centimeters may have trouble placing the device. Also, men with very long prostates may have a similar issue where it would require lots of different clips in order to get a good result. Prior to placement of a Urolift procedure, you should have a measurement of the size of your prostate. Sometimes a urologist can get an idea of the size of the prostate from the cystoscopy or camera evaluation of your bladder, but oftentimes a urologist may measure the size of your prostate with a transrectal ultrasound or review prior CT scans or MRIs that you may have done of the pelvis to get an idea of the size of the prostate. Typically, prostate size is reported in grams or cc's. This is a combination of the width times the length times the height of the prostate times a factor that takes into consideration the usual shape of the prostate. And then, as you may know, grams is a measurement of weight, and size of the prostate is measured in volume, but it's usually assumed that the prostate weighs about 1 gram per cc. I mention this because the FDA originally approved the Urolift procedure for prostates smaller than 80 grams in size, and has recently changed that to be 100 grams in size. Now, overall size in terms of grams or total volume of the prostate is probably not as important as the prostatic width as measured on ultrasound, um, but that's a general size recommendation. Men with prostates much larger than 100 centimeters in size probably not going to get a good benefit from the procedure and should look for alternative procedures. The second most important factor, in my opinion, is the presence of a median lobe of the prostate. Most prostates have two lobes and two lateral lobes that compress inwards on the urethra. And when you look in the urethra with a cystoscope, you see those two lobes pushing in on the middle. Now, based on prostatectomy specimens and anatomy specimens, about 5 to 10% of men have what's called a median lobe of the prostate. The median lobe grows from the center of the prostate and grows posterior inwards towards the bladder. It oftentimes looks like a ball valve sticking into the bladder when we examine it with the cystoscope. Sometimes these are small, and sometimes these can grow incredibly large and have a very large ball appearance inside the bladder. Now, the median lobe can be hard to treat for a urolift for several reasons. Number one, if it's growing significantly into the prostate or has a large intravesical component, then the capsule for this is inside the bladder. And you're not going to be able to place a clip through that appropriately in order to compress the tissue. There is an indication to use the Urolift for a median lobe of the prostate, but this is best reserved for smaller median lobes where a big portion of that median lobe is inside the prostatic urethra. In order to treat it, the urologist places the clip and moves that median lobe to the side of the prostate and compresses it inside the prostatic urethra. That clip still has to be fired laterally through the prostate in the safe section of the prostate, which is the lateral mid to upper section of the prostate, to avoid damaging any significant structures around the prostate. Many median lobes can be treated with this, but some median lobes are simply too large or have too much of an intravesical component, and a Urolift procedure is not right for those individuals. Other important considerations that I should mention today include things such as clotting disorders. If you have a significant bleeding disorder that has not been treated, you should not get Urolift, as firing that needle can cause bleeding and can be significant if there's a clotting issue. On the same token, if you're on antiplatelet or anticoagulation medications, you should be off of them before getting the Urolift procedure. So, to summarize today, the Urolift procedure is a fantastic operation that has revolutionized the treatment of BPH for men. However, it is not for all men. Certain men should look for alternative procedures if they're having significant lower urinary tract symptoms. However, there are limitations to this procedure. Men with prostates that are too large, men with prostates that have a significant median lobe that grows into the bladder, or men that cannot come off of anticoagulation or antiplatelet agents should not undergo the Urolift procedure. Overall, I hope you enjoyed the video. I hope it was educational. If you have any questions, please put them in the comments below. Again, I'm Daniel Resnichek, a urologist here in Bellingham, Washington, and that's all we have for our video today. Thank you.